Blepharitis simply means inflammation of blepharum. That is the eyelid. But when we come to the medical term blepharitis, this inflammation is most often limited to the lid margins. Because as far as the total lid is considered, this lid margin has much importance. Because it is having the most tough hair of the body, that is eyelashes, and associated with or at the root of each eyelash there are two different types of glands. One is sebaceous glands and other is sweat glands, like that. And other than that, this is involved in the various functions also. Eyelid is generally used to close the eyelid and to close the eyeball and to protect it from external pathogens or other any factors. But there are so many other uses also for this particular structure, and these secretions produced by these glands of eyelids, that also has a role in the dryness of the eye. So if that is deficient, the probability of this dryness is more. So this blepharitis like that deviates to so many angles in its characteristic features. The main symptoms, signs and symptoms are redness of the eye and discharges, sometimes glowy or sticky nature of the lids, especially in the morning, and itching, severe itching will be there. These are the characteristic features. And there are different types of blepharitis. That is, sometimes will be swelling and wetty type. And there are another type in which it will be dry and crusty. The crusts will be deposited over the lid margin. And on this basis, the classification varies. According to Ayurvedic theory, when it is dry and this crusty in nature, we have to consider dominance of Vata also in the inflammation. Generally speaking, inflammation is dominated by Pitta. But if it is in this particular form, we have to consider Vata also. If it is high discharge is there, redness is there, watering is there, then Pitta can be considered as the dominant feature. That is the main difference. And these symptoms will not be limited to that symptom alone. There is a tendency of chronicity for blepharitis. And as the period goes, as the chronicity increases, the symptoms also may get increased. Sometimes there will be a permanent or may not be permanent, temporary also, changes in the structural form of the eyelids. The eyelashes may fall off. It will be falling off continuously, and that will create some other problems. Sometimes what happens, the eyelashes will be deformed. There will be a tendency to bend, and it will touch the cornea. That is a very dangerous situation. So from being blepharitis, it turns to keratitis or inflammation of the cornea also. And if so, the treatment of that disease also is necessary. And sometimes what happens, there will be swelling of the or a severe inflammation of that particular glands that I told associated with these eyelashes. Then there will be some just like a stye or the gland, inflammation of meibomian gland, that also will happen. So there the inflammatory exudate will be accumulated or deposited in the glands. That is another thing. So different types of characteristic features are there. Whether it is spreading to cornea or spreading to the glands seriously, like that it varies. Accordingly, the treatment also varies. If the glands are more inflamed, there is need of to evacuate their glands. And if this is associated with other symptoms like not only keratitis, sometimes it may be spreading to conjunctiva, which is covering the eyeball in general, then it will be known as conjunctivitis. So, most often blepharitis is not limiting to the lid margin alone. Even though it is told lid margin inflammation, it is not limited to lid margin. Just like any other disease, this particular condition, blepharitis, also can be analyzed on the basis of Vata, Pitta and Kapha. So, without the action of Vata, Pitta or Kapha, no disease are developed. So, here we have already seen there are different types of blepharitis, maybe dry and crusty in nature, or watery and swelling fluid flowing like that. And that is the result between it is already proved that is there are different factors behind this. Generally speaking, we can say that it is something like a Pitta dominant. Since it is an inflammatory condition, Pitta is the dominant feature, and the pathological action, or we will say that is samprati like that, the terms are different. In that we can say there is Srodho Rodham. Srodho Rodham means some blockage to something, maybe to vessels or in channels or openings, whatever it may be. If there is anywhere, if there is some blockage, that is known as Rodham, Srodho Rodham. Here the Rodham is mainly on the hair follicles and the openings of the eyelids. Then what happens? The secretions or any of the fluids that should be drained out, that should be come out, it will be blocked and it will be settled. That is due to the vitiation of Kapha also. So, Kapha comes to the picture. Then it becomes, if it is comes to a chronic stage, it becomes Kapha and Pitta dominant nature. And if it is after that, if it becomes dry and there is no opening also and it is not coming out, then crusts will be formed, then Vata also comes to the picture. That means in different stages, on different conditions of the disease, different doshas comes to the picture. And accordingly, the treatment also will vary. It is treatable in Ayurveda. And the treatment varies from one stage, one clinical stage to another clinical stage. Anyway, basic aim of the treatment is to control the inflammation. For that, various steps are there. That varies according to the stage, clinical stage. If it is in a simple inflammation, initial stage, Robana Chilsais, Robana means healing. That will be the basic aim of the treatment. For that, different procedures are there, and there the dominant feature element will be Pitta. That means initial stage of the blepharitis, Pitta Shamana Chilsa will be more important. And when it becomes chronic and recurrence is often happening, then we have to consider Kapha also. Then Kapha Pitta Shamana treatment will be necessary. That treatment will be known as Shodhana Chilsa. And different types of Shodhana Chilsa are there. Initially, this Shodhana of the general system is important. For that, Nasya, that is evacuating the channels and promoting the circulation. That type of treatment can be done. And later, Shodhana of the localized structures. For that, a particular treatment is there in Ayurveda known as Anjana Karma. Anjana is applying medicines along the lid margin. That is very important. And if there is blockage to the this one, I mean the gland openings, there we have to open it. To some treatment should be done to open the glands and facilitate Robana. That means healing process. And in the case of the crusts and this dryness of the lid margin, then Vata Shamana should be considered. For that, different types of these ghee preparations having healing property that can be applied. This is the basic line of treatment. It is already seen that the treatment varies according to the clinical stages and the condition of the disease, chronicity of the disease. And very important thing is that I have already told Nasim is very important in the treatment of almost all blepharitis. Then comes Robana Chikitsa, healing type, and if this blockage is very severe, there will be some obstruction to the blood supply and accumulation of the blood, impure blood on the lid margins. For that, there is a very successful treatment in Ayurveda known as Jalauga. Jalauga means a medicinal leech that comes under the group Hirudomedicinalis. It is used for the purpose of bloodletting in blepharitis. So, that treatment procedure, Jalauga is highly successful and in the treatment of this blepharitis. And after eliminating the impure blood and making the channels proper, then we can do other types of treatments for the healing purpose. This blepharitis is treatable and curable in Ayurveda. But it doesn't mean that it will not recur. Recurrence will happen only if the trigger factors are coming again. And some disease has the nature of chronicity. Blepharitis comes under this group. That means there is a tendency to be chronic. And the chronic, it becomes chronic only because we are using the causative factors. That means apatyas. Apatyas means those factors which are responsible for the development of the disease. Then it will be remaining as a chronic disease. Otherwise, if you are treating it and it's getting good results, and then if you are stopping all the patyas and not stopping the apatyas, then what will happen? It will recur. That is the difference. By a perfect treatment, it can be totally cured. And if you are following the instructions to avoid further recurrence, it will not recur. That is my experience. But some factors, just like some cosmetics or which are not good for the eye. Because there is one term in Ayurveda, chakshushya. That means those factors which are acting on the ocular tissues. And on that, those which are positively acting, that types of drugs only can be used for regular practice. Otherwise, since the lid margin is having too much glands and all the openings, the development of any infection is more easy. That is why it is becoming chronic. That is why recurrence is common. Any chronic disease may develop complications because any structure is not limited to that particular structure. It is connected with so many other neighboring structures. So, chronicity is the factor for the development of complications. Just like diabetes is a chronic disease, so it is having so many complications. Hypertension is a chronic disease, it will develop complications like that. Blepharitis also is a chronic type of disease, so complications are possible. So, since there are different types of glands in the lid margin, an inflammation will touch these glands, chronic inflammation. And this chronicity and the inflammatory condition is persisting in a chronic blepharitis. So, the glands will be growing to accommodate with the inflammatory exudates inside that. So, there is a tendency of extra growth of these glands or the associated structures. This may lead sometimes very dangerous situations such as cancerous growths. Like that, the rolling of the eyelid is a complication. Since the chronic inflammation is there and the vascularity is already damaged, the deformity of the eyelid also may happen. That I have already mentioned. So, the eyelashes may touch the cornea or the eyeball, and it will develop that type of disease also. So complications may develop if it is not treated in time in a good way. A perfect Ayurvedic treatment has a good prognosis, because if you are treating it with appropriate medicines according to the dosha dominance, then treatment is successful. For the way to first of all it analyze whether Vata or Pitta or Kapha is the dominant feature. Accordingly, we have to plan the treatment. That is the importance. If so, treatment will be 100% successful.